Well, we are waiting to hear from the Los Angeles coroner's office later today. They'll be performing Michael Jackson's autopsy this morning. We expect a statement after that happens by this afternoon, but there have already been reports from people close to Jackson that prescription medications may have played a role in the 50-year-old superstar's death. Joining us now is Dr. Urschel, who is an addiction specialist and a psychiatrist and the author of a book called Healing the Addicted Brain. Dr. Urschel, thanks very much for being here. And obviously, at this point, it's speculation, which I typically try to stay away from. But so many reports about prescription drugs, his battle with addiction has been well documented. When you hear cardiac arrest, what does that tell you as a medical doctor?
Well, let me just say, Rick, that again, as you said, we were not sure exactly what medications or what issues are going on. But with cardiac arrest, that's where the heart stops and or the lungs are not able to get enough oxygen to the brain. That combination both combinations can look at very similar and can be termed cardiac arrest.
So what leads to cardiac arrest in a 50-year-old, seemingly healthy man?
Well, there's all kinds of causes, everything from infections and just clogged coronary arteries. There's a variety of circumstances, but I think in general, if you're using combinations of prescription narcotics and pain killers and tranquilizers, that can be a very dangerous combination unless monitored very carefully.
And antidepressants. There are some reports, Doctor, Life and Style magazine reporting that in the last few months, Jackson was on a cocktail of prescription drugs, up to 7 perhaps, including Xanax, Zoloft, the antidepressant, Demerol, a painkiller. How dangerous is it for a typical person to be taking all of these drugs all at the same time?
Well, if that combination can be dangerous unless monitored very carefully. That combination can cause addiction. The prescription narcotics and tranquilizers can cause addiction, although it usually doesn't unless you're already addicted to something else like alcohol, marijuana, or cocaine. However, even if you're not addicted to these substances, that combination can cause death by shutting down the area of your brain that keeps you breathing, or by causing your lungs to fill with fluid. Either scenario can cause death many times by a heart attack.
Let's talk about addiction because that's your specialty. So many questions now about his alleged drug problems. Did he have enablers? This was not a man who lived in isolation. He certainly had an entourage. Should someone have noticed if Michael Jackson was taking too many medications at the same time, abusing those medications, or not taking them properly?
Well, again, there's all kinds of controversy and reports around that, but usually if somebody is addicted to the substances, many times people, all different types of people in their lives, friends, family members, employees, co-workers, all know that this person has a problem with addiction, and many times the person that's addicted is the last person to know. However, what's really important, especially I talk about my book, like you said, Healing the Addicted Brain, it really is, we now have great treatments for addiction. Most people don't think you can get treated for addiction, that it's just not treatable, and that could not be farther from the case.
Well, Michael Jackson allegedly was treated for an addiction to painkillers some years back. You know, we know that people who suffer from addiction to alcohol, it's a lifelong battle for them. Is the same thing the case with people who are addicted to drugs, prescription drugs in general?
Absolutely. Addiction to alcohol, prescription drugs, stimulants like cocaine, methamphetamine, these all cause a chronic brain illness, an illness in your brain that lasts for your entire lifespan, very similar to diabetes, high blood pressure, or asthma. And if you treat the disorder of addiction, the chronic brain disease, effectively like you would treat these other medical disorders, you get a very, very positive outcome. In fact, the success rates can skyrocket. The problem is most people aren't treating these addictions effectively. They're not using the latest tools that science has brought to the table that can skyrocket these success rates.
Dr. Urschel, we understand that Michael Jackson had to undergo a very long an involved physical examination for insurance purposes before his upcoming concert in London. Is there any way that you can imagine that these kinds of medical tests would not have turned up, at least in some blood work that presumably would have been done as a part of these tests, some kind of addiction or drug use that he was actually battling?
Well, I mean, that's a very good question. When people are on prescription narcotics or other drugs that can be abused, usually those drugs will show up in urine drug screens or other lab tests. And so if none of those were found during the evaluation, then that's just one more piece that shows that maybe addiction was not playing a role here. Again, there's not a blood test we can give for addiction, unfortunately. We can't do a blood test or a breath test and say, hey, this person's addicted and this person's not. But you can definitely see physical signs both in the urine and even in different organ systems if an addiction's ongoing.
If drugs played a role here, doctor, the sad truth for his fans and family members that this could have been prevented. Is it your belief as an addiction specialist that this was a preventable death?
Well, again, I don't know enough about Michael Jackson's specific case, but let me just tell you that addiction treatment in general can be very successful. Again, this book, Healing the Addicted Brain, is targeted at the lay public, and the reason that addiction treatment in the past has not been that successful is we're not using the latest scientific tools. For instance, there's a medication out there called Suboxone that works wonders with patients with prescription narcotic and other narcotic addiction, and allows them to treat the addiction, especially when used in combination with other treatments, but at the same time allows them to have a great quality of life.
Right. Dr. Hal Urschel is a psychiatrist and addiction specialist. Great to have your insights, sir. Thanks very much for joining us this morning.
Thank you for having me.